All right, it looks like I'm live. Yes. Hello, hello. Awesome. It looks like Dr. Johnson just joined. Let's see. Perfect. Hi, Gisela. Hi,
Ah,
Mommy. Hey, David. Hey, Jess. Hi, Dr. Johnson.
how are you, Dr. P?
Good. How are
I,
you?
I am doing well. I'm excited now that I'm on with you.
I'm so excited to have you here. Thank you so much for, coming in and sharing your expertise about this very dear to my heart matter, which is type 1 diabetes.
Yeah, and thank you for asking me. It is such an important conversation, and I think this is one that honestly doesn't happen enough when you talk about type 1 and mental health together. So I'm excited.
And what better time that May and the month of mental health awareness, right?
That's right. Yeah.
It looks like some friends are joining in. Thank you so much for everybody who is taking time of your either lunchtime or break from work or break from school or like that. Thank you so. Hopefully this will be the first of many, right, Dr. Johnson?
That is the goal. I think we should take this show on the road.
All right. Well, I think we have a few people. What do you think? Should we wait a couple of minutes
Yeah.
or maybe,
we
yeah?
we can wait another minute or so. I would be curious to know where everyone is joining from.
Oh,
Like, what
yeah.
city are you joining from? Because I'm seeing names that, of course, I don't necessarily recognize. They may be all people that you know, but I love seeing where people are from, and I think it also helps someone go, "Oh, wait, I live there, and you live there. Like,
Yeah.
let's connect."
Yes, please come and tell us where are you joining us from? Okay, Kissimmee, Florida. Oh, my neighbor. Yay.
Ohio,
Oh, yo. All righty.
New
New
Jersey, what's up? Oh, we got a lot of jerseys. Winston-Salem, North Carolina. I will say, true story. I've never met anyone from Ohio that I did not like. I don't know what it is. We got Fairfax, Laurel, Mount
nice.
Pleasant,
Montana. Each of them.
except
Whoop, whoop. Winter
Winter
Garden.
Garden. Where's that?
Oh,
That
that's
sounds
next.
familiar.
Dr. Peralta, how are you? Queen City, Salisbury. Okay, wow. A
Welcome
lot
back
of
from Cape Town to Atlanta. Oh, Arkansas. Wow. Mahopac, New
awesome.
York.
I
Ohio,
would
another one.
love to see some thumbs up if you are somebody who lives with type 1, or if you are close to somebody who lives with type 1. That could be if you're a caregiver, a parent, a spouse.
Mhm.
I would love to see some thumbs up. We just want to see who's our audience today.
Yeah,
Hi, Jess.
I love it.
All right. Well, I think we probably can go ahead and start. Would you
Let's do
say?
it.
Awesome. Well, I just want to open the forum first introducing myself. My name is Dr. Penelope Pauley. I'm a pediatric endocrinologist. I practice in Orlando. I have been practicing for the last 10 years and loving every minute of it. Um, I'm a wife of someone who lives with type 1 diabetes, and so I practice it in my day-to-day job, but I also somewhat live it at home, just because it impacts not only the person that lives with type 1, it impacts their family and their caregivers as well.
Mhm. Wonderful. And I'm Dr. Charryse Johnson. I'm a clinical mental health therapist and wellness consultant. I've worked with type 1 patients and families for the last 12 years. My probably longest term type 1 patient I've worked with since they were 13 and they're now 23, and we still work well together. So I'm a huge advocate of understanding how the physical and the mental really impact each other and supporting families and individuals on making it easier.
I love it. And I mean, I hope that those of you, we have friends here with type 1, families, patients. Awesome. I love it. So one thing that I always like to open the forum, and just like when in my appointments, is, you know, living with type 1 it's a full-time job. It's a full-time job that the person in the family did not apply to. It's a 24/7 deal, literally. There's data being thrown, they're being bombarded with data literally every 5 minutes if they wear a sensor, and they are having to make all kinds of decisions, sometimes eating what they don't feel like eating, which I think is like the worst feeling ever, because like when you eat because you're hungry, that's you feel some, but when you have to eat when you don't want to, that actually makes you feel sick. And these patients, these families live with it day in and out, and up to 50% of the person and their families who live with type 1 diabetes by a year and a half from diagnosis can be impacted by mental health issues. And this can be, sorry.
Go ahead.
Yeah. No, this can be any of the mental health, issues. It could be stress. Diabetes stress is a real thing. It could be depression. It can be anxiety. It could be disordered eating. Go ahead.
Yeah. No, part of what I was going to say is I think that's a misconception, or something that isn't often understood, is that if you have a family member that has type 1, or you yourself do as well, it impacts the entire family system, right? It impacts the way you travel, how long you're out of the house. It impacts, even if you have multiple children, right? That's an element of, you're going to find that one child has a different and higher set of needs if they have type 1. And then how do you balance that with the needs of the other children in the family? So it's a very intricate dynamic. And I love that you brought that up, because I think it's easy to think, oh, let me just deal with this person with type 1, and like everyone else is off dealing with it in a different way, but it impacts everyone.
Every single one. And like you said, dynamics of the family, things that, typically you wouldn't think about. Going to a birthday party, it could be traumatic for a family of a child with type 1, because especially at the very beginning of the diagnosis, they have this misconception that the little boy or the little girl can never eat sweets. So let's just not go at all to the birthday party, or let's not let them ever have a sleepover, and do typical social things that we will allow our kids. But diabetes becomes like a barrier, and it tends to like almost isolate the family, because they just don't feel like the little guy, the little girl will be safe.
Yeah. And the hope is that by having conversations like this, we can give families a little bit more confidence that please allow your children to do everything that you would allow them to do if they weren't diagnosed with type 1. And the only difference is you make different accommodations, you communicate differently. That might mean if they want to do the sleepover and you're not ready to allow for that yet, then you go and let the other family know, hey, I would love to help you and be there. Not because I'm a helicopter parent necessarily, but let's acknowledge it can be scary to allow your children to be with someone else and know that something could happen. And then just helping your child also get comfortable in social settings. I will say this, while they're young, will help them as they get older, and kids are asking, what's that DEXA scan? What's that thing that you have on you? Why are you doing these different things? So isolating and then being thrown into a situation where you can't isolate creates anxiety. So it's really helpful, if they were diagnosed young, to make it gradual.
Absolutely. And like we have discussed in the past, you and me, helping them become their own advocates, because that little boy, that little girl, it's going to grow. It's we can't avoid. So they're going to grow, and they have to integrate in society. And for better or worse, we live in a culture where everything is social, and so we don't want to isolate them and let them be, not live the typical things that kids their age will be living.
Yeah, and that's a big part of the work that I do with clients as well, right? Is sometimes people will think that a mental health therapist is only for if you're crazy or things are really, really horrible, but there's a part of what we do that's also like coaching. So I help give students language around, you're anxious about going to this event. let's kind of role play. If someone said this to you, what would you feel comfortable saying, and have them say it with me. And then by the time they have to say it later, they feel a lot more comfortable.
I love that so much. And that is why there has to be this principle of not, like I recommend it, I can like order it, but I
Yeah.
usually recommend my patients after the first year of diagnosis, I recommend a family therapy session.
Yes.
Because, not just for the little boy or little girl, the whole family dynamic, it's impacted. A lot of times the parents are the ones that develop anxiety, and they become even unwillingness. They become helicopter parents because, like, to your point, they feel like nobody will care or do as well as they would for their child. So it's important. Mental health needs to be addressed. It's as important as knowing what your blood sugar is.
Yeah, I would love to see it be a part of the care plan. So if you're going in every so often and you're meeting with your endocrinologist or anyone else in your team, that you're also going, oh, at the same time, I'm going to plan that mental health appointment if you're not doing it consistently. A few other kinds of things that if I'm working with a family with type 1 or managing type 1 that we talk about might also be balancing the load between parents. Because a lot of times in the family, if it is two parents, there's one parent who learns all the information, figures out everything, and then there's the other parent who is like, I'm kind of paralyzed and I don't know what to do. So that's another dynamic of then that parent is carrying a load that's too heavy, and then their self-care isn't as good because they feel like, well, I don't know if I can leave you with the other parent because they don't know all the things. So really balancing out the distribution of making sure the entire family understands how they can help while also teaching that child how to help themselves.
That is so real. And that goes even for like nuclear families. We're not even talking about dual households. Nuclear families where, for instance, the mom is, let's say that only the mom came to the appointment and she feels unease of me making recommendations just because, dad is not here. He's the one that does the diabetes thing. And I'm like, no, the diabetes thing is everybody needs to know everything about it. So yeah, you touch a very important point there. I also wanted to bring up the misconception about type 1 diabetes versus type 2 diabetes. Because, when usually I deliver this diagnosis, which by the way, it's always hard, no matter if it's type 1 or type 2, I always get asked, is it the worst type? Is it the type, or what is this gonna go away? So I would like to take 1 second and just really go over the differences between type 1 diabetes versus type 2 diabetes. And so with type 1 diabetes, we typically talk about an autoimmune process, which means your body is not recognizing the pancreas as its own and starting as a result, as a consequence of that. The pancreas stops making insulin, and that person is going to be dependent on insulin for the long run. It's something that happens genetically. You're genetically predisposed for this, and there's a trigger that happens that makes the body start that attack. And unfortunately, once it starts, it goes, right? Like, we know now that we can identify people that are at risk, and now we have a medication that can help delay the progression once that attack starts. So it's something really new. We have very few people that have been covered by insurance, but it's something that is in the works. Type 2, it's going to be, culprit is going to be mainly lifestyle, poor choices, weight. There's, poor choices in terms of eating habits, exercise, and there's typically a very strong genetic. So if you have a parent with type 2 diabetes, 50% chance for your child to be diagnosed with type 2. If both parents are diabetic, type 2 diabetics, chances are 90 to 100% chance. So as an adult, to take care of ourselves so we can help lesser the chances for our children.
Yeah, those were beautiful explanations. And it made me think of, imagine a teenage boy or girl, right, who is navigating, finding out that they have type 1. And even the emotions around my body doesn't work the way I would like it to. And I don't have any control per se over how my body works. That alone is extremely emotional when a young child, a teen, an adolescent just wants to go. They just want to do what everyone else is doing and not have to think about it. But their life is a lot more work in order to do some of the same things. So there's that balance between helping them really acknowledge, yes, things are very different for you. I don't want this to keep you from doing things that you love, but also know in the beginning when they're younger, if they find out when they're younger and they're trying to figure it out, they may not show a lot of emotion around what's happening. That will change as they grow, as they go through puberty, and their body is even more inconsistent, right? Because of all the hormones, and they're like, I can't get this down. And then into high school and into college, each season in their life developmentally is going to create different emotions around what it's like to live with this, because it becomes a little bit more complicated. So don't think, oh, it's never really bothered them, I can't tell. Let somebody else have that conversation and really give you insight on what they're holding.
And you know, that was beautifully said and so true. Like, depending on what stage in life you are, your diabetes care, it's going to be a little bit more not difficult to handle, but there are going to be more factors impacting on your control. And to your point, rapid growth, puberty, lack of sleep are factors that are going to impair or impact insulin action. So I am sure, and if you are not aware of this, talk to your pediatric endocrinologist or your endocrinologist, because in those seasons of life, your need for adjustment are going to be so much more. And that is good to know, so it can lessen the frustration from a parent standpoint. Like, I'm doing everything as I'm always doing it and nothing's working. You know, when your life is tied up to data, it's so much harder when you feel that validated by the number on that sensor, that A1C every 3 months when you see your doctor. It's like, I like to say that A1C doesn't define you. It doesn't mean anything. It just tells you where you have been. It gives us ground to work on. It doesn't mean you're good or bad. It just gives you a point to work.
Right. And if something's not working, get support, right? Don't stay away from your endocrinologist, your pediatric endocrinologist. If you feel that we've been doing the same thing and it used to work, well, there could be other little factors, like you said, that have changed. Don't suffer on your own. Don't go to Google and think that you can figure it out by doing the research. Please, allow yourself the support there, because it is essential and helpful, and just having a listening ear is going to make a huge difference.
I love it. Well, I was wondering if you could give us some measures or quick tips, maybe not just tips, that could help families or individuals that are living with type 1 diabetes or around of type 1 diabetes to try to lessen or minimize chances for having issues.
Yeah, I think number one is being willing to kind of acknowledge what you're experiencing from both a physical and emotional place. Kind of like you said, it's not good or bad depending upon your number. Being willing to say, I am feeling more anxious than I normally would, or I'm noticing myself, we have something we call anhedonia, which means less interest in doing desired activities. If you feel like living with type 1 and managing it is causing you to withdraw or isolate because you are overwhelmed, that's kind of a warning sign that we would want you to point out and be able to talk with someone. You mentioned at the very beginning of our time about disordered eating. So diabulimia, which is a specific type of eating disorder that is conducive to people that have type 1, we see those dynamics a lot more than I even feel like they're talked about. So also notice changes in your child's eating habits. If they are being more resistant, if they're starting to restrict because they feel like this keeps me within that number better, then that can be a challenge. And watch out for stress and transition. Those are two sneaky times, and they come multiple times, but stress and transitions impact our hormones, impact our nervous system, impacts our insulin levels, and that can also kind of throw off your blood sugar. I see that specifically in my late middle school students, high school and college students. So prepare yourself for understanding that stress is a big factor for your child, and help them not withdraw from I'm tired of the data, because that is an element. So if you're also seeing that they're turning their scanner off, or they've taken you off of being able to read it because they're trying to disconnect, that is an issue and could really be harmful to them physically. And the last two things that I will say is find support. Find community support. The Beyond Type 1 app is phenomenal, and there's an area on there that talks about specifically community. And I often like to tell people about ADA camps, which are across the nation, and they're summer camps, but specifically for children who have diabetes, so that they can have those summer camp experiences, but also be surrounded in an area that has trained staff that would be able to meet their physical needs.
That's amazing. Great, great information. So to piggyback on summer camps, there's a big, huge conference. It usually happens here in Orlando on the fourth weekend that week. It's called Friends for Life, and it's not only for the kids who live with type 1, it's for the whole family. They have seminars, conferences, talks, workshops for families, for parents, for spouses, for caregivers, for the children, and they break them down by age, and you can, it's again to the whole family. So they involve the kids living with type 1 and kids that are not living with type 1. And it's amazing. It's so well organized and so well run. I believe they also have it in California. I may be off on this, but yes. And also Beyond Type 1 has another program that is like a buddy and pal. So you can have somebody who lives somewhere else in the world, and you can be your type 1 buddy almost. So it's connection. Connection definitely needs to be there. And I can give one tip for parents. It's especially for those that are super on it. Like at the beginning, the parents are the managers of the diabetes. As the kid transition and goes through puberty, I just want to advise, take the whole independence piece step by step. It's not like do it now. Oh, now you're a teenager. Now you do it all. That needs to happen smoothly. And so the faster you transition to the child doing everything, higher chances for them to not do well, because they're not going to be doing as much. So it's better to start doing things like, we're going to be counting carbs together. And then you transition to, okay, now you're going to count carbs and I'm going to double check, and still put the insulin and so forth, like step by step, just to try to get more attainable for both parties.
Yeah. And that's a way to build their confidence, right? That's a part of advocacy. So it's not just the verbal, it's I do know how to take care of myself. And if I'm out somewhere with friends after a game, at an event, then they can kind of scan and know this is what I need. Or the other thing I would say is always making sure that they have something with them in case of an emergency, in a little bag, a backpack, whatever they're using, just so if it's a random situation where they can't get to what they need, then you at least know this is something that they always keep with them, and really incorporating that all the way through.
Fantastic. I just want to go through the comments to make sure that we have not missed any questions. Okay. We have a lot. Thank you, guys. Okay, let's see. World Traveling Journal. What if your parents are older? I think older, same percentage. For type 1 diabetes, the incidence goes from 1 in every 10,000 people with no family history to 1 person for every 300 if you have a parent with type 1 diabetes. So the chances are much higher if the dad has type 1 that lives with type 1 versus if the mom with type 1 diabetes. For type 2, Yeah, the stats are the same. That's why making lifestyle changes early on is so important, because genetics is so much prevalent with type 2 diabetes. Um,
And I've
my
definitely
son,
seen from a mental aspect too, the older someone is, the more difficult it typically can be to manage some of the emotional changes. And part of that is because they're set in, I've lived so much of my life this way that there's almost this grieving process around having to take on more ownership. So know if you are supporting someone that's older as well, you may see a little bit more pushback because they're
Mhm.
looking to regain a level of control.
You're absolutely right. I always talk about like my toddlers versus my teenagers being diagnosed, and the teens are so much of a harder group to not
Mhm.
manage, but like it's such a bigger impact because, to your point, they knew how life was before,
Yeah.
and they're willing to let go of that, so it's just a little harder. And Love Mary says, my son was diagnosed at 14,
Mhm.
suddenly, terrifyingly. He's almost 18 now. His adult independence terrifies me. It means I have to let go and allow him to manage
Yeah.
without my
Yeah.
helicopter. Yeah. So, I mean, maybe I feel like you both need to, probably would be a good idea. He was diagnosed at 14. It's been almost 4 years from diagnosis. Definitely family therapy would be a good idea, because
Mhm.
a lot of time there's so much friction over diabetes that it can part the relationship that you have with your son, and that's so important because he's always going to be your son.
Mhm.
So I will say that's the first thing, and work towards independence little by little.
Yeah, and I can speak to this in terms of, she says we're worried about how to support him in college. So I have several type 1 students who are in college right now. Every college campus, that's whether private or public, has an accommodations department. And we often don't think about accommodations being needed and helpful for those that live with type 1, but it absolutely is. You want to work with the accommodations department the moment that your child is accepted, and look for accommodations around testing, being able to be in a different environment or have extended time. This is because when they are coming out of a type 1 crisis or blood sugar crisis, concentration changes, their ability to focus, right? So if that happens right before time for finals, that's a dynamic. Other things to consider would be getting accommodation so that they can have a car. If it's a school, for example, that does not allow freshmen to have a car their first year, a type 1 student needs a vehicle in order to make sure that they can go and pick up their supplies, to make sure that they can have the food that they need, or potentially even go to a local area if they need to be seen by an endocrinologist. And then when it comes to them being asleep or struggling, you want to make sure that the RA and the RD, depending upon the college, knows about their situation, makes accommodations for them to have a refrigerator in their room if that is not possible. And you will want their roommate to also be someone that is comfortable with recognizing, if I hear this DEXA scan go off and I don't see my roommate getting up within a few minutes, I may need to go over and bring them a juice and get to them. So that's very important and crucial steps to consider. And that's why that advocacy is important, because if they're going into college and like, I don't want anybody to know, that increases the risk of harm.
Also, Love Mary, she worries here. She says about the lows. He's on his own. He's sleeping and doesn't wake up. Looks like, I'm sure you've heard of Baqsimi. It's a nasal spray that you can pretty much use it just like any nasal spray. So the roommate may not necessarily need a lot of training, because in the past we use glucagon injection. It's a little bit more daunting when you have to ask somebody to prep the shot and give a shot, in a situation of stress, not really thinking straight, which is totally appropriate. So the nasal spray, it's easy. Like Dr. Johnson said, RA needs to be aware. Also, you can request a room that is closer to the cafeteria for the
Correct.
same sense of the diagnosis. So this is really helpful, and you can find a lot of other ideas. And beyond type 1, there's a college section. You can find a lot more tips there as well.
Which is
He has vaccines.
also why you would want to have them with a therapist, because in order to get those accommodations, they will often need written verification of how long have they lived with this, and here are the accommodations and why. So that's the other reason for getting them linked up with a really great therapist.
And the other thing will be, hopefully he, as you said, manages phenomenally, which great. I hope that he, technology is on your side, and if you can get him in one of the hybrid loop systems, that will also give you a little bit of peace of mind. I can tell you that once you are on the hybrid closed loop system, you can see that at night those blood sugars look so nicely straight as an arrow for the most part, unless issues, but definitely look into that if he's not wearing one. All right. Well, this was great. What do you think, Dr. Johnson?
I think it was amazing. I love the conversation. Hopefully everyone found it very helpful. And I would encourage you to share this with other people that live with type 1. And I feel like part of our responsibility as a community is, even if I don't live with type 1, this is great knowledge for me to have, because chances are I know someone or have a friend that is living with this, so I can learn to be more compassionate towards them.
I agree. I really enjoy our conversation, and I look forward to more in the future. Thank you for those who joined. And if you know of somebody who can benefit from this conversation, make sure that you share it. And I think we'll close the chat for now.
All right. Sounds good. Have a great day.
Bye.
Bye.